Surgery for this gentleman. We've also done a neoplasty. His issue was, you can see here, the lip was locked, and you can see the face, the lower third was not proportional, very sharp chin, and you can see it's already corrected. Sorry. Okay. All right, open your mouth. Yeah. Bite. So there's issues with opening his mouth now because we've done osteotomy on the sides as well. We've done osteotomy here as well. We're going to show you the side view too. Look at that improvement. So as I mentioned, his jaw has come forwards. It's come downwards. This grooving is reduced. So once he closes, it's going to be mild. So the mandibular groove is very strong. He didn't have a clear jawline. It gave him a much better jawline. In spite of the swelling, you can see the jawline and the definition from the neck, which is so much better than in the pre-op. Front view once more. As I mentioned, main area of work, this side, angle, angle. Now, this is only what you're seeing outside. We've also improved his bite. So we've gotten the entire jaw forward with the teeth. So which means that his bite is going to be much better. The severe deep bite that he had, which was traumatic, causing problems to the upper and the lower front teeth, is going to be solved now because we've got it forwards. And as you can always see, that improvement in bite also translates to improvement in facial balance and facial proportions and for facial aesthetics. So some more pictures that you see. You can also have a look, maybe. Sorry. Okay, well down. So you can see the difference, yeah. And mind you, this is swelling. We have some swelling there as well. You can show me this side. See the balance in your face, yeah. Vertical height, proportions.
This looks is like a bit more wider than this time.
It's going to be fine. It's swelling. It's all swelling now. We're going to take a scan now and show you what's happened inside to the plates and screws, where we've placed the screws and everything. But it's all swelling now. See, the swelling is going to be there for long for you. It's just not even a week, right?
Yeah.
It takes time for it to resolve.
How long?
I think swelling will be there for 2-3 more weeks. And for you to feel comfortable with the lower jaw, with regards to opening and closing, maybe 2-3 months. I mean, no one else will know that long, but you will still find little tightness, some little difficulty in opening the mouth, especially chewing food and all that.
And do I have to do any physiotherapy?
No, nothing. Just let it be. It'll heal on its own. The muscles will reattach on its own, and you'll be fine. You might, as I said earlier, need to go for braces, but that we'll consider later on. Nothing else, nothing to do now.
Okay.
All right. So apply ointment, which we'll give you. It's like a gel, actually, more of a gel. Apply that inside the mouth, so that will prevent any infection to get into your bones. Brush like gently but regularly 2 times a day. Don't eat very chewy food. Don't rinse your mouth too much. Gentle rinsing. That's just the intraoral care you will do. That's all.
And can I start eating? Like I'm just.
Yeah, you can start eating semi-solid now.
Yeah.
Idli types.
Idli types. Yeah.
Not still chapatis.
And I mean,
No rotis yet.
Rice soup.
Rice, soups is fine, but to chew on rice, wait for a couple of more days.
Okay.
After day 10, you can do that.
Okay.
All right? All right, take care. So we'll take a scan for you now. Scan it through. And once we take the scan, you'll be able to see what's happened inside also. CBC.